Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
So, we are talking about now the chances for treatment. Before you get treated, there are criteria that you have to meet. Meaning what? The treatment is not for everybody. Like for this patient now, the old patient that we checked and we looked with the ultrasound machine and we found the liver is cirrhotic. Can this patient be available? I am not able to take calls right now. Can this patient be eligible for treatment? The answer is no. So before I decide who gets treated and who doesn't, I must run an ultrasound. I must look to see if the liver is good meaning non-cirrhotic, is not fibrosed yet, is not scarred yet. So the liver is not cirrhotic, and this way I can say this patient is eligible to take the treatment. What is the treatment? The treatment could be monotherapy, that means one drug treatment. There is lamivudine and there is entecavir, as entecavir is much better, is a bit more expensive. And there is also alpha-2b interferon injections. Those are a bit expensive. So we can double the injection with tablets, or we can just do the tablets, any of the 2 kinds that I have just mentioned. Can you take this medication in your own? Oh, the doctor said the name. You cannot. You have to see a physician, and the physician has to prescribe it for you based on your situation. You have to do the panel. You have to do all the ultrasound scan to see if you're eligible for the treatment or not. We have to see, if the scan is good, you take the medication. And it takes about 6 months, and then we scan you again. 52% of the times, or even more than that, will recover after the first 6 months. What if you continue to be positive after 6 months? You eat the medication another 6 months. Oh, but that's too much. What, would you rather get hepatitis complication and liver cirrhosis and go for liver transplant? Or you rather take the chance and get treated now, especially if you are in the 30s or 35 or 40s, young age? Which one will be better for you? Obviously, to take the treatment. Even if it's 1% chance I cure, I will take it. Because you don't want to think about hepatitis. Hepatitis is a silent disease. It hits you after 10, 15 years. And at that point, you don't want to think about it. I told you, you will be bleeding from above, from the mouth, vomiting because the esophageal varices has broken and burst. You will be bleeding from below because the rectum varices has blown up. You will be having ascites. You will be in albumin for a lot of time. 1 vial of albumin is about 100,000, and you need few. And after you exhaust this albumin, you're going to need another albumin to keep the blood inside your vessels. Plus, your health is deteriorating. There is nothing you can do. You're in bed, you fatigue. It's bad. It's very bad. And when you're young, you won't feel it. But it will kill you slowly. At one point, once all the liver is cirrhotic, there is nothing else you can do. You're not going anywhere. So, my advice to you out there, get it checked. And not by the rapid test, by ELISA. ELISA is the most accurate. You ask for ELISA and get tested for hepatitis, It's on the rise. I'm not creating panic. I'm just advising you, as a young audience out there, to be on the lookout. Hepatitis is sexually transmitted, and it is bad if you get it. What will be worse is ignoring. You're not immune. You're not. You must be checked, and if you have it, you must do the panel. The panel target what I need the panel for. I need to see if you have which one, the E. If you are in the transmission state or not. If you can give the virus to someone else or not. But once the surface antigen is there, you have hepatitis. Case closed. Once the surface antigen is there, you have hepatitis. If you develop core antibody, usually the core antibody starts with an antibody called IgM, is bulky, is big, antibody that is big. Over time, it becomes IgG, smaller. And that's the one that goes through the placenta to the baby to give immunity to the baby. Okay? Now, we tested. We seen the surface antigen. We treated you. After 6 months, we don't see the surface antigen anymore. But we see surface antigen antibody. Congratulations, you are treated. We see the core antibody that is becoming IgG. Congratulations, you are cured. So I can tell you, you are cured when the surface antigen, that red thing on the diagram that I have shown you, has disappeared from your blood. Yeah, that thing there, that red one outside to the outmost layer, that red thing, we call it surface antigen. If it disappears from your blood, you no longer have hepatitis. After a month, because some people go, like let's say, now you go, you come to me, I test you, you are negative. Wow, congratulations, bravo. What is the next step? Take a vaccine. The vaccine is done 0, you take it now, in 1 month and in 6 months. Okay, I took the vaccination. But doc, after you give me the vaccine, I went there and I don't see the, I don't see surface antigen, which is good because you are negative anyway. And I don't see the antibody. Your vaccine is fake, doc. No. You're missing the fact that it takes about a month, we call it a window area, or a gap, a gap time, or a gap window, or whatever you want to call it. However, it takes a month for the IgG against the surface to show. So if you take the vaccine today, don't go and test next week and say, hey, your vaccine is no good because I don't see the antibody. It takes some time for your body to develop an antibody against that vaccination. You know? What is a vaccination? It's a surface antigen. I'm giving you the surface antigen, only the surface antigen. I'm not giving you genetic material so the virus can go and replicate in your body. I'm only giving you what? The surface antigen. So when I introduce the surface antigen into your blood through that injection I give you here, is given here by the way, what happened? Your body now is forced to form antibody against the surface antigen. That takes about a month or a bit more than a month for that surface antigen antibody. That is your means of protection, your body protecting you through those antibody. I see antibody against the surface antigen that I injected you with. It takes a month. It doesn't form right away. So that means the vaccination is not fake. It's there, but you are missing the fact that it takes time for the antibody to form. I think we covered hepatitis, top to bottom, right? We cover hepatitis very well. And I cannot stress enough that if you are a young man or a young lady, sexually active, get tested. It's 5,000. I do it for ELISA with the ultrasound screen. It's not expensive. Know your status. Well, I'm getting a lot of messages and a lot of calls. It seems like I touched a very important topic that a lot of you are concerned about. So I'm happy that I can be of help. The production, Mr. Johnson, send me a few questions here. Does hepatitis affect human in general? Yes. If you are human and you have sex, or you transfuse blood, or you're in the medical field and you get in, you are exposed to needles and blood transfusion and all that, yes, you are at risk. Now, let me talk, because I had one of my nurses accidentally get a needle stick. Let me tell you about needle stick. The chances for transmission, whether hepatitis or HIV, from a needle stick is 1/250. What does that mean? Meaning you can get the virus from the first stick, or after 250. So it's not right away. Why is that? Because that virus, once it gets outside, you take the needle outside, now the blood with the virus in it is exposed to air, it dies. So it cannot survive in vitro. In the air, it cannot survive. It only can survive inside. So it's a very fragile virus. So getting a virus from a needle stick is less likely. Why? Because the virus cannot survive in the open air. The virus cannot survive in the open air. It only can survive once inside the body. Mr. Johnson from production, give me some questions that was sent to him. Does hepatitis affect human? Yes. If you have a liver and you are human and you having sex, yes, it can affect you. If you transfuse blood, yes, it can affect you. If you work in the medical field and you stick yourself or stitch your finger, yes, it can affect you. Does hepatitis affect sexual intercourse? Of course, it's sexually transmitted. Hepatitis B is sexually transmitted. And we said it only transmits when the E for envelope is there. When you do the profile, hepatitis profile, and you find E antigen positive, boom, that's the stop sign there, no sex. That's the stop sign there, no sex. Why? Because it's the envelope that wraps a piece of the DNA inside of it, and it goes through the seminal fluid or the vaginal fluids to your sexual partner, and boom, sexual partner now have hepatitis. Okay? So, but if you only have the surface antigen, I'm repeating, if you only have the surface antigen, you cannot transmit as long as you are E negative. The envelope is not shown. And let me say one more thing. You have to get this done at a reliable lab. I seen it. There are some results that are false negative. And I seen it, some results are false positive. You have to get accurate results. And if you're not comfortable with those results, you go to another lab and confirm. Because we are talking about hepatitis, we're talking about your life. We're not talking about malaria, typhoid. We're talking about hepatitis, a silent disease that will kill you if you don't take care of it. And it can be cured. And it can be prevented. So now we have the technology, labs are everywhere. Find yourself, if you're married, if you have the envelope antigen or not, before you have sex with your wife. And then seek treatment. Okay? E-antigen transmit the virus? He said yes. Okay. What is the sign and symptoms of hepatitis? Okay, well listen. The signs and symptoms of all hepatitis are the same. You know, we have hepatitis A. We have hepatitis E. The A and E, they come in from food, fecal oral, meaning contaminated food by fecal material or so from somebody who has hepatitis, you get the symptoms. Hepatitis B, acutely, the same symptoms. I'm going to discuss what are the symptoms. Hepatitis C, acutely, the same symptoms. But see, A and E, yeah, you can get the symptoms. What are the symptoms? Well, you're gonna see yellow, jaundice, a little bit of jaundice, yellow. This white in the eye becomes yellow. The urine becomes dark. Yeah, so a little bit of fever, a little bit of fatigue, a little bit of weakness, not specific symptoms. But the most important thing is dark urine, yellow eyes. That is hepatitis. But the thing is, hepatitis B skips that. Not necessarily to see jaundice with hepatitis B. With the easy one, hepatitis A and E, they are easy. They'll take their time and they will disappear. Whether you treat or you don't treat, they will go away. So it doesn't bother me. What bothers me is hepatitis B. Hepatitis C less likely in Cameroon or in Africa because, you know, we don't have that much. But hepatitis B, many. And especially the last couple of years. Many young people. Many. So don't underestimate hepatitis B, my friend. And I want you to be on the lookout. You're strong now. You're healthy now. But you don't know what's inside of you. Check your liver for hepatitis, please. It will help you. Let me move to another topic quick now before, you know, because I had planned to talk about this. Something called cholelithiasis. And that, you remember when we talked about that old patient, we said the gallbladder wall is thick. The gallbladder wall normally cannot be seen, very thin. When it becomes thick, that means the gallbladder is what? Is inflamed. The gallbladder is inflamed. And when the gallbladder, what is the gallbladder? You see, another function of the liver, it makes something called bile. And this bile is that substance that digests fat. We need bile to digest fat. So the liver makes this bile, and through those many ducts inside the liver, it stores the bile where? In that sac there, underneath the liver. We call it gallbladder. So, when we check with and this is all by ultrasound, by the way. If we check by ultrasound and we see the wall thick and we push the probe or we put our finger there to try to touch the gallbladder, the patient jumps. We know this is an infection in the gallbladder. We call it cholecystitis. Cholecystitis. So that's an acute infection of cholecystitis. You know, that has to be treated. And unfortunately, you cannot treat it by tablets. You have to treat it by drips, special medication drips, and then the condition will be gone. Is no problem. And, you know, it's a serious condition. It's a serious condition. The gallbladder wall is thick and the patient has pain, right upper quadrant, okay? So the patient has pain in the right upper quadrant, and when you touch it with the probe, you'll see it with the machine, with the ultrasound, and when you touch it, when you push the probe inside a little bit, the patient jumps, you know that you have cholecystitis, inflammation of the gallbladder. Inflammation of the gallbladder. Okay, no problem. Now, what else the gallbladder can we see in the gallbladder? What else can we see in the gallbladder? We can see stones. You know, and the funny thing is, those stones coming from cholesterol. And sometimes we test the patient for cholesterol. The cholesterol is normal, yet the patient has stones in the gallbladder. Sometimes those stones stay in the gallbladder, does not bother anything. They're just there. They don't bother you. They are just there sitting in the gallbladder. But some other times, those stones move to the neck of the bladder. They move to the neck of the bladder and they cause obstruction. Now, the bile is accumulating inside. So now, at some point, the bile will spill over, and this bile is to digest fat, and it goes and digests the pancreas because it's close by. And now we have very bad pancreatitis, and that is deadly. I think my time is up. I will discuss this topic again to finish with the liver. And definitely, I'm going to get a lot of questions. We'll answer those questions in the next session. You have a nice weekend, and I will see you next Sunday at 8 o'clock. Please be there. We'll discuss a very important topic, hepatitis and biliary tree. Thank you very much. God bless you all. Thank you.